The American healthcare system is badly broken.
We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, I probably get paid $1,500. For me to spend 45 minutes with a patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
Soldiers' use of prescription drugs has tripled in the past 5 years.
This medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
We're really mortgaging the future. Not just the health of healthcare, we're talking about the health of the nation.
My wife was a patient of Dr. Green's, and subsequently I became a patient of Dr. Green, and my aunt that I brought with me from Arkansas and Ohio became a patient of Dr. Green's. I was an athlete most of my life. I've been swimming since I was 3 years old. I played football, went to college on a basketball scholarship, and I am the typical athletic type. I take for granted my health. I didn't go to doctors, and then I suddenly realized that when I got over 50 years of age that I started gaining weight. When I got over 60 years of age, I was gaining more weight, and I wasn't taking care of myself the way I should. And fortunately, I met up with Dr. Green, who has different outlook on what we should be doing about our health and physical wellness. And so as a result of that, I have actually lost 70 pounds. And I actually got my life back. It's made a big difference. I'll be 75 this year. And you don't know what you have until you don't have it anymore. And you don't appreciate what you have until you lose it. And you appreciate it that much more when you get it back. And Dr. Green's been able to do that for me.
Most likely, I'll be the first clinician to really take a look at so many of your records from all the doctors whose exams and finding are relevant to you. You see, most doctors in their specialties work with the information that's relevant to that specialty. I may be the first doctor who has the chance to take a look at all of it, to see the big picture. It's like trying to guess what a jigsaw puzzle is from that one piece. I dare you to do it. But if you have all the pieces, then the picture comes into focus. I look forward to helping you find the answers to get the health results you need and you deserve, that you've been looking for, and that's brought you to me, so that you can live the vibrant, happy, healthy life you deserve. Thank you and welcome.